All right, good afternoon. It is Wednesday, March 15th. We are working off of revised voting list number 14. Patrick is still with us, so we'll start with his bills first. Thanks, Patrick.
So the first bill to consider today, Senate Bill 356. This is the bill that expands the responsibilities of the Citizens Committee for the Enhancement of Communities Surrounding BWI Thurgood Marshall Airport to include developing projects designed to improve public safety, the quality of life in surrounding communities, and education, advancing projects brought to the committee by nonprofit organizations, and making recommendations to the Secretary of Transportation for the funding of projects that address these matters. The bill also doubles the minimum annual funding that the Secretary of Transportation must budget for projects recommended by the committee from $1 for every takeoff and landing of an aircraft that occurs at BWI for the most recent available calendar year to $2 for every such takeoff and landing. And then Senator Lamb is offering an amendment to the bill that would increase the number of members on the Citizens Committee from 11 to 12 and have one of the members of that Citizens Committee be recommended by the senator representing District 12 and also have it so that the members be representatives of community associations that are either wholly or partially situated in the most recent certified noise zone that was adopted under statute for Baltimore Washington International Thurgood Marshall Airport.
So we have Senator Lamb's amendments, the sponsors nodding. We're all in agreement on these amendments. Okay, are there any questions on the amendments or Senate Bill 356? I'll entertain a motion.
Second.
Have a motion and a second for a favorable on Senate Bill 356 with amendments. All those in favor, please raise your hand. Unanimous report on Senate Bill 356 as amended. Next bill.
Senate Bill 511. This is the Health and Human Services Transportation Improvement Act of 2023. This is the bill that would establish a state coordinating committee for health and human services transportation in the Maryland Department of Transportation. The duties of this committee include examining transportation needs of state residents who are elderly, have a disability, or require transportation access to jobs, health-related appointments, senior citizen programs, or other programs requiring the transportation of individuals who qualify as transportation disadvantaged. This committee will also coordinate efforts in the state to provide quality health and human services, transportation services. They'll devise a transportation plan and serve as the clearinghouse for health and human services transportation coordination issues. The bill repeals the limits on annual funding for Maryland Senior Rides program, and the Job Access and Reverse Commute program administered by the Maryland Transit Administration. And as introduced, the bill would have established a rural non-emergency medical transportation program and required an appropriation for that program. Amendments in front of you offered by the chair would strike that provision of the bill, which establishes that non-emergency medical transportation program. That's the element of the bill that comes with the $1 million fiscal note, $1 million plus fiscal note, and otherwise the rest of the elements in the bill would go forward. It's my understanding that these amendments are like what the House is moving forward on.
Okay, so we have amendments to Senate Bill 511 and Senator Hershey.
Thank you. So just at the end of page 7, then what's
what's the governor shall provide funding for the program in the state? What does that refer to?
That is language that doesn't require mandated appropriation, but because we're striking language that initially established a cap on funding, this language is in place instead of that, so that it requires the governor to provide funding for the program, but ultimately it's still within the governor's discretion to do so in terms of the amount.
But the program's very different than what was originally introduced.
The program is the same. It's just repealing this provision above it, which capped the amount of funding that could go to the program at $400,000 annually. So it's removing that cap so that if the governor wanted to appropriate more money for the program, the governor could do that.
All right, and then you mentioned something about the non-emergency rides in rural areas. That's not in here anymore.
So what's not in the bill anymore? Yes, it's the non-emergency transport program. That's the program that would have the $1 million annual appropriation. So you can see that's the program that's established beginning on page 2 of the reprint through page 6 of the reprint. So that part of the bill is being struck, along with the mandated appropriation that would go with it.
All right, thank you.
Senator Reedy.
I'm sorry, I'm just trying to understand. What does this do now? It establishes a coordinating committee, right?
Correct.
And what else?
And it repeals caps in statute on annual funding for the Maryland Senior Rides Program.
Oh, I see. The administration may not award more than 500,000.
Right.
But honestly, okay. So the bill does do something. I was gonna say, you don't really need a bill to establish a coordinating committee, but that's fine. Okay.
And it's my understanding from the testimony that piece of the bill, the coordinating committee, was something that the Rural Maryland Council had identified as a need based on some roundtables that they had scheduled last fall. And there apparently used to be this type of coordinating council.
Oh, and they did.
And it had since lapsed. And so this is an effort to revive that.
Okay. Thank you very much.
Good questions. Any further discussion on the amendments or Senate Bill 511? I'll entertain a motion.
Move favorable.
Have a motion and a second for a favorable on the amendments and Senate Bill 511. Any questions? All those in favor, raise your hand. That bill receives a unanimous report. That's it. Thank you, Patrick. We're going to Nathan's bills next. Thanks, Nathan.
The next bill on the list is Senate Bill 216. And that's a bill that was heard just over a month ago. So the bill removes treatment of illness, disease, or injury from the definition of what massage therapy does not include. So currently, statute states that massage therapy does not include the diagnosis or treatment of illness, disease, or injury. And this bill removes or treatment from that exclusion. So that's on page 2 of the reprint. The bill also repeals language specifying that a nonprofit health insurance plan, insurer, HMO, or third-party administrator is not required to reimburse a licensed massage therapist or registered massage practitioner for services rendered. That provision is on the unnumbered page of the reprint. And so the bill is described thus far passed the House unanimously. So at the request of the board, Senator Ellis is offering the amendment shown in the reprint that addresses a problem that the board raised about a week ago. And so in short, an individual may be licensed by the board, or they may be registered with the board to practice massage therapy in a setting that is not a healthcare setting. And so a bill passed in 2022, before Health Occupations was with the Finance Committee, that phased out the registered massage practitioner credential and prohibits the board from issuing an initial registration after October of 2023. And so the issue that the board raises is that the massage education programs have not been able to update their programs and have those programs endorsed by the appropriate authority in time for the deadline. And as a result, the board adds that there are currently students enrolled in courses of study who have already paid their tuition, but who will only meet the requirements for registration, not licensure, when they graduate. And so to address these issues, the amendment delays by 1 year the date by which the board must stop issuing registrations to allow additional time for education programs to update their curriculum and allow students to receive an initial registration to practice in non-medical settings.
Okay, are there questions on the amendments? Senator Lamb.
Thank you, Madam Chair. Just a clarifying question for council, and I think I'm almost certain this doesn't touch on that, but we had an earlier bill that dealt with penalties for people granting massage. Just want to make sure that this doesn't affect that at all. So if I wanted to give Senator Kramer a free massage, I'm still able to do that.
That was a
Unpaid.
different bill that
That was a different bill.
already advanced, and that provision was amended out.
Okay, so this doesn't touch on that at all.
Not at all.
Got it.
I certainly have something.
All right, any questions on the amendments or the bill? I'll entertain a motion. Okay, I've got Senator Reedy and second by Senator Ellis. Right, I have a motion and a second for a favorable on Senate Bill 216 with the amendments. Are there any questions? All those in favor, raise your hand. That bill receives a unanimous favorable report. Next bill.
Next bill is Senate Bill 255. As shown in the reprint, the bill requires the Department of Health to expand access to and provide reimbursement for specified wraparound intensive in-home and case management services relating to the 1915I Intensive Behavioral Health Services for Children, Youth, and Families program. So beginning in fiscal 2024, the Behavioral Health Administration must fund 100 slots in the mental health case management program for children or youth who are not eligible for Medicaid services and are at risk for out-of-home placement. The governor must include funding in the budget for customized goods and services for youth receiving services under the 1915I model or mental health case management program. And there's additional uncodified language that requires specified consultation and reporting requirements for MDH. So the amendments strike a provision related to expanded eligibility criteria for Medicaid recipients, and that's found on page 4, and codifies a recurring report. So the amendment that would strike the expanded eligibility is from the sponsor, and that addresses the high fiscal and policy note, and the chair is offering the amendment that would codify the recurring report. The Department of Legislative Services requested that since it would be recurring indefinitely, that it be included in statute.
Senator Hayes.
Thank you, Madam Chair. Nathan, you went past it really quickly, but it was a concern of mine. It said some of the amendments have addressed the $3.5 million fiscal note on there. Does it eliminate it completely or is significantly reduce it?
There are still costs, but it would likely be less than $1 million. So it breaks down this way. With the inclusion of subsection D on page 3 of the bill as it was introduced, the department was interpreting the bill as expanding services under this program to all children who were authorized to receive Medicaid services. So over 100,000 individuals. The amendment makes clear that the only expansion that the bill
To the 100.
is the 100 slots, 50 slots of which exist in the program currently. So the effect then is that the bill only expands the number of slots in the program by 50. And therefore the expenses related to the services being provided, I think, are somewhere in the neighborhood of $300,000. And then there are some personnel costs for the Department of Health to deal with the expanded program that represents another approximately $300,000. And perhaps most importantly, the the additional contractual services that the department said they would require under the bill as introduced, that they estimated at $3 million, is now, according to the department, an indeterminate number, but likely to be smaller because the population being addressed by the bill is smaller.
Right. So is it, I guess you talking about like $300,000 to $500,000 for the behavioral providers?
I think the two things for which there are specific numbers are somewhere in the neighborhood of $700,000 annually. And then the contractual consulting services.
Thank you, Madam Chair.
Thank you, Senator Reedy.
So these are, we had the discussion about children being put in like hotels or being put in, having to stay in hospitals. That's who we're talking about, right?
Yes.
And we have 50 like that right now. What this says 100. I thought I heard it was like 140 to 150 type cases. We've had so many different bills and I'm trying to remember.
So the number that you're referring to, the 100 slots, is for children and youth who are not eligible for Medicaid services. There's a separate subset. So
And that's
currently,
this 1915I, they're the separate subset.
there are slots in the program currently that are for Medicaid eligible children and youth. And then the bill was requiring the 100 slots for children and youth who are not eligible for Medicaid, of which there are currently 50 slots.
And are those filled right now?
So the testimony that was received was that no, that there are very, very few slots filled. And there were a number of reasons discussed. One of them was the lack of providers at the rates that the department was able to pay under the program. And that's another provision of this bill.
So this is going to go up to 100, but it doesn't mean there's always going to be 100. There could be.
Yes.
But why expand the slots if we don't have enough right now? Or you think there will be more because we'll be providing the services, or?
I think that that's the intent of the bill's sponsors, that there will be more as the program is better utilized. The sponsor wanted to ensure that there was a certain number of spaces available for people who are not receiving, children and youth who are not receiving.
And if it was 100 slots, it's 700,000. If we fill those 100 slots, it'd be $700,000 potentially.
The department's number, the estimated fiscal impact was based on the overall effects of the bill after subsection D is removed,
After
which
it's
they
removed.
had said would expand it to 100,000.
No, I got that.
Yeah, as to the specific number of slots that they were, I believe that it was the information provided by the department that was the total fiscal impact of the bill.
Oh, that would include any administrative costs, or
The $600,000 or $700,000 number includes the administrative cost.
Right.
Because a component of that
which
was,
just, it seems like it's a lot of money for annually for, if it's 100 kids at $70,000, that's 70, I mean, 700, that's like $70,000. Now I know these are difficult cases, but all right. Okay. All right. Thank you very much.
Thank you, Senator Hayes.
Thank you, Madam Chair. Nathan, Senator Reedy made the statement, asking a question if these were the individuals that were staying in hotels and stuff like that. All of the information that we've got so far, that the young people that are having to stay in hospitals and stuff are in foster care by a statute of just having a foster care or in-home care designation, they're automatically entitled to Medicaid. So if that's the case, what children would benefit from this that are not receiving Medicaid?
what that are not currently
All
receiving?
kids in care are automatically qualify for Medicaid. And so I thought we were saying that this would also cover individuals that would not qualify for Medicaid. And so who would those kids be?
Out of the universe of children and youth who are not eligible for Medicaid services, I can't say specifically who would be recommended for this program. I believe the bill is specific to children who are at risk of out-of-home placement.
So they may be in like family pres, they may be at home care and receive. Got you. Okay, thank you. I appreciate that. Thank you, Madam Chair.
Yeah, thank you. I was looking at the same thing, Senator, and read intensive in-home. So, yeah. right, are there any additional questions on the reprint of Senate Bill 255? Entertain a motion.
Move favorable.
Have a motion and a second for a favorable as amended on Senate Bill 255. Are there any questions? All those in favor, raise your hand. Bipartisan package, behavioral health, unanimous vote.
My hesitation, I want to take care of these kids. But when I hear that they're not Medicaid eligible, and my colleague tells me we want to keep them from being institutionalized, which I totally agree is cheaper. Do parents have to pay, if parents have the means, do they have to pay anything for their child's at-home care? If we pass this bill, or do they have to now? I mean, what's,
I don't recall that being addressed in testimony or the information that the committee received.
I mean, I got no problem if you're Medicaid eligible, you're gonna get Medicaid coverage, but if, and I know just because you're not Medicaid eligible doesn't mean you're wealthy, obviously, but I'm gonna vote for the bill, but I because I want to take care of them, but I'd love to know more, but maybe I can find out obviously offline. Thank you.
Thank you. We'll move to the next bill.
So the next bill on the list is Senate Bill 506, which as amended and shown in the reprint authorizes the town of Forest Heights in Prince George's County to undertake urban renewal projects for blight clearance by exercising the power of eminent domain to acquire properties in blighted areas that are zoned for commercial and then as amended or residential purposes. The town may not initiate an urban renewal project unless its legislative body adopts a resolution that defines the area that rehabilitation or development is necessary and in the public's interest. So, and in condemnation of land or property under the bill must be conducted in accordance with procedures under current law. So the amendment adds areas that are zoned for residential use to the scope of the authority as described.
Hey, are there any questions on this local bill? Senator Hershey.
Just the buzzword came out, eminent domain. Is that on just commercial properties or could it be used on residential?
So the amendment offered by the sponsor on page 3 in line 22 specifies that the municipality may undertake and carry out urban renewal project in areas of municipalities that are zoned commercial or residential. And then following from that, I believe that the eminent domain authority that would be required to be conducted under the requirements of current law would then apply to the residential property
Residential as well.
as the commercial.
Are they vacant?
All right.
The delegation saw the
Hmm.
Yeah. I'm gonna hold that just to check with the delegation to make sure that we saw the bill with the amendments that were just presented.
Residential.
Very good. In that case, then-
Senator Beidle?
Just one quick question. Are these blighted buildings vacant that they're going to take by eminent domain?
I don't. I think
That's just a question. Are they,
I don't know which bill, I mean, I don't know which buildings that the governing authority
I'm
would.
just concerned if someone either has a business or is living in a home that we would take it by eminent domain. And when I was reading the definition, it doesn't say anything about vacant, cause a blighted area declined in productivity by reason of obsolescence, depreciation, or other causes. So just some concerns there. Thank you.
Okay, we'll move to the next bill.
Next bill is Senate Bill 581, which establishes a behavioral health care coordination value-based purchasing pilot program in the Department of Health. So the purpose of the pilot program is to establish and implement an intensive care coordination model using value-based purchasing in the specialty behavioral health system. And MDH is required to administer the pilot program, which must be operational for a 3-year period. For fiscal years 2025 through 27, the governor must include in the annual budget an appropriation of $600,000 for the pilot program. There are no amendments, and this bill was included in the leadership behavioral health package.
Senator Hayes.
I don't know, Madam Chair. $700,000 here, $1.8 million here. The outcomes in this bill, Nathan, I'm just not sure. I see a lot of these bills around behavioral health, focusing on the behavioral health providers benefiting. But if you look at the outcomes on page 3, line 17 through 25, there's not a whole lot here to actually benefit the patient. I could say that 24 and 25, those lines may get to it, but it doesn't actually provide for any outcomes to the wellness and well-being of the patient really in this bill. And I know it's titled value-based, but it looked like the only value is given to the providers in this case, in this bill.
The outcomes are what's important.
Right. So the outcomes are emergency department utilization of behavioral health. So these individuals are receiving intensive individual care. So if I'm getting individual independent care of a whole team, it's obvious that I'm not going to be in an emergency room, right? The other outcome that's listed number 2 is inpatient hospitalization. Again, same reason. If I'm getting independent individualized care, it's less likely for me to have inpatient hospitalization. Total healthcare costs, obviously the emergency room is a lot more expensive than having inpatient care. And so there's going to be some reductions there. And then the other 2 outcomes is outcomes for recipients with or without primary care services. If you're getting this, if you have this coordinated team that's providing intensive care, obviously the outcomes are going to lead to you having more primary care if all they have to do is recommend that. So it seems like there's $600,000 each year over 3 years, $1.8 million for outcomes that are obvious that are going to happen, but no real benefit necessarily, or there's no empirical data that say that these outcomes are beneficial to the patient. And then if you look at the agency's testimony, they wrote it as informational, but it might as well have been unfavorable. If you look at paragraph 2, it says the Maryland Department of Health. MDH notes that there are several important and complex considerations to study prior to establishing a program. MDH will need to examine the different value-based methodologies, and that speaks to the outcomes that I just named. They can't validate that these methodologies are worth the value in which they're asking for from the state. And then they go on to say MDH will also need to determine what the impact is on the medical necessity of the criteria. None of these outcomes speak to the medical necessity of the actual patient. They go on further to say that furthermore, the implications of paying for the service through the administrative service organization, including the monitoring and adjusting of the claims and having an effective audit methodology. So, they're obviously pointing out that there may be some difficulties if they were to audit it to make sure that these outcomes were compliant, that there may be some difficulties. I thought that maybe given all of the issues that the department may have raised, they actually recommended that there be a feasibility study, but it seems like the bill as it's postured is continuing to look at outcomes that haven't been validated or verified by the department.
Yep, I'll go to the sponsor, but I believe the bill as introduced was based on a 3-year pilot project on this, but I'll let sponsor.
And this type activity is the way medicine is going. We passed Senator Battle's bill last year. So, this is the current way that we're trying to serve people and take care of people.
Right, but the health department is questioning the methodology that's included in the bill. And so, it's setting a 3-year pilot, which we will get information back. But the pilot is measuring these outcomes that are outlined in the actual legislation.
Senator Mounts.
How, do you have the testimony on how long the department's been working on, I get my words correctly, on, value-based results in the testimony? Because I understand it's been the past 10 years.
So I don't
Under a
have,
health commissioner that was an engineer, not a medical professional.
But so the purpose, with the purpose of the pilot program, wait, the purpose of the pilot program is to, sort of move this concept of value-based results, force it on the department a little bit. So I get the testimony the department's putting together. I think my question is the bill has a pilot program and it's intended to produce a result to see if this actually works. Is there a better way to build a bridge? Once upon a time, it was low bid. That was the best way to build. And that's changed. Now it's high bid, let's get the best result. I'm not saying that spending the most money, even though I did do a tax bill the other day, I'm not saying spending the most money is the best way to achieve a result. But I think one of the frustrations that we've experienced in the mental health world is that there's treatment, and the same result. And the goal is to come up with a comparison of the following data elements before and after enrollment of the recipients. Those are the individuals. It's emergency department utilization for behavioral and somatic health purposes, inpatient hospitalization, total health care expenditures. It kind of lays out goals of this pilot program in an area that hasn't seen any improvement. And I guess I'm arguing the bill a little bit. But my question is do you have testimony or information about the problems and challenges that the stakeholders have had as far as getting this sort of review criteria, data set, whatever you want to call it, out of the department?
so I think you summarized the issue accurately. I don't have the specific testimony in front of me to be able to sort through at this point and quote to you the specific experience.
And it's 600,000, correct?
Yes,
For 3 years?
correct.
Okay. 500 participants. At least 500. Is that correct?
Yes, at least 500 adults whose behavioral health condition or functioning places them at risk of hospital emergency department utilization or inpatient psychiatric hospital admission.
Okay, thank you.
Thank you. And I just wanted to reply also, just remembering back to the press conference and the introduction of the package of behavioral health bills. And I'm recalling that in that conversation, we talked about the value-based care started as a somatic care. It started in the physical health instead of doing volume-based where providers were paid by the number of people they saw. The desire was to move people towards value, where you're getting quality outcomes. In order to do that, you have to have a baseline of where you are, then build a program and measure certain metrics. And so this program is based on trying to build those metrics, collect that baseline data so that we can then measure those outcomes. The same thing happened. It was a part of the whole global budgeting for healthcare. This is taking that model that was used for healthcare, kind of the expansion of primary care. You all those of you that are in the healthcare space may remember HEDIS measures where we measured certain outcomes with certain disease areas, but you have to get a baseline of that information first. And they put in the bill certain metrics like the number of ER visits, so that if there is a reduction, we would then know that and know that those services that are provided are adding the value that we're looking for. So that's my little understanding. Senator Hayes?
I think Senator Mouse was dead on, right? The bill already established the metrics, right? So based off of the metrics that are outlined in the statute, that will determine the success. With what the agency that is the foremost experts on this, like I think there's some smart people around here, but I don't claim to be an expert in health. The experts that we rely on in the agency are saying, give us an opportunity to make sure that the metrics that are in here are actual outcomes that will make a difference. And we're making a decision despite the advice that the department is given to use these outcomes that's outlined in the bill.
A really good hearing when the professionals were all here.
First of all, I don't remember anything about it that day. And again, I said I would do the bill because of how successful your bill was last year. And I agree with everything that the chair said. And if we continue to go down this road and you need questions asked, I'll hold it and I will talk to the mental health expert that I know.
No, I appreciate that. And Madam Chair and Madam Vice Chair, that's what I was simply going to ask for. When I saw this coming up and I'm looking through and preparing a vote, I'm like, let me look back over the testimony. And I saw this letter that was in our bill file here. And it seemed like a good bill. We want to try to make sure that people who are suffering from mental illness and others are addressed. I just don't want us, look, we have some smart people, but us as politicians making the decision based off of what is good outcomes without taking the advice of the people who have the expertise in that area. And it sounds like the department, those people who have that expertise is saying, hold on real quick. I think we're moving in the right direction, but give us an opportunity to look at the methodologies.
Okay, so the sponsors offered to hold the bill. Did you want to add something?
No, I was just going to say, I go by the experts that are out in the field working with patients every day. Well, of course they're getting paid, not what they should get paid though, but as far as I'm concerned. But I will hold the bill and we'll take care of it and it'll be ready for tomorrow.
Yeah, no, respect. We are going to consider the testimony that we have from folks and, respect your desire to get more information, but I don't think we mean to question the motives of any providers that are taking care of folks. So we're going to hold the bill. Senator Lamb?
Kind of listening to all this, and I think I understand Senator Hayes's hesitation with what the department was saying. I think there's also just a general tendency within the department to kind of want to resist and kind of take a look at things. And I think this is where we use our judgment, hearing from folks in the community, whether it's positive or negative, to make a decision whether to move forward on this. I think there's just a general sense of hesitation coming from the department on anything that may require them to really be innovative in some ways. And so I think this is a reflection of that too.
All right. Any further discussion on the held bill? All right, we'll move to the next bill. Good conversation.
Senate Bill 801, as shown in the reprint, establishes a Cyber Maryland program in TEDCO to create a pipeline for cybersecurity, serve as a hub for state workforce development programs in cybersecurity, and generally coordinate cybersecurity and research and innovation in the state. The bill creates the Cyber Maryland Fund as a special non-lapsing fund to be administered by the program, and establishes and specifies the membership of the Cyber Maryland Board. for fiscal 2025 and annually thereafter, the governor must include an appropriation of $250,000 for the fund and sufficient funds to cover specified staff in the program. The amendment adds a sponsor, and on page 4 adds for-profit corporations to the list of organizations and entities authorized to receive grant funding under the bill.
Okay, is there any discussion? Okay, have a motion for a favorable. Is there a second? Okay, have a motion and a second for a favorable on Senate Bill 801, the Cyber Maryland program. Any questions? There is a sponsor amendment, so we're considering the bill favorable with amendments. All those in favor, raise your hand. Okay, that's a unanimous report.
Was the other amendment described where it adds for-profit corporations to the list of organizations? So it's more than just the sponsor.
Okay, so everybody okay with the for-profit addition?
I thought you actually meant the sponsor.
I
of the
did,
bill's
but
amendment.
yeah,
but
I
you're right.
did.
There was a sponsor of the bill's amendment and a sponsor.
And it
Was,
adds a sponsor.
but the amendments were from the sponsor and that was, yes, so everybody okay? All right, the unanimous vote is adopted. Woo, long day, long day. Next bill.
Oh.
Thank you, Nathan. We're going to David's bills.
The next bill on your list is Senate Bill 160, and I believe without describing it, you're gonna hold it, right?
Yes, we're gonna hold that bill. We're gonna have I had a conversation with the sponsor today, Senate Bill 160. We're gonna hold that bill.
Okay, the next bill. The next bill on your list is from Senator Beidle. It's Senate Bill 228. And as amended, you have a reprint in front of you, which I'll go through very quickly in a minute. But as amended, the bill requires each area agency on aging to establish a long-term care and dementia care navigation program. The long-term care is part of the amendments, and requires the Maryland Department of Aging to oversee and train long-term care and dementia care navigation program staff. The purposes of these local programs include providing access and referrals to programs to long-term care and chronic care disease services, and that provide support to individuals with dementias and their caregivers. Beginning on fiscal 2025, the governor must include an annual appropriation of $2.4 million in the budget to manage the program statewide and to fund programs locally, with the funds distributed proportionally to each area on aging based on a formula. You have a reprint in front of you with some amendments. On page 1, you'll see that the name of the program has changed, and this is from the chair, actually. These amendments are combined chair and sponsor amendments. And also at the top here, I forgot to put it in there, but Senator Hester wanted to be added as a co-sponsor, so that will also be in the amendments that you consider. And then if we go to page 2, again, the top of the reprint, you'll see that long-term care and is added to the program, so it would expand the scope of this newly established program if this bill passes and is enacted. And a lot of these changes here are strike the reference to a dementia care coordinator, which was in the bill as introduced. And also it would make it the same as a House bill as it was introduced. I know there's other amendments out there that they're considering over in the House on this bill. And at the bottom, you'll see in the middle of the page, it strikes a reporting requirement, and at the bottom, it replaces it with a more comprehensive reporting requirement, which goes on to the next unnumbered page. If you go to page 3 of 4, and this is from the chair, this adds to the scope of the program to provide access to and referrals to long-term care and chronic disease services The rest of the amendments are from the sponsor, which clarify the existing purposes of this new program. And that goes all the way down to the bottom of the page, and there's some clarifying changes on the last page of the bill, consistent with changing it to long-term care and dementia care services.
Sponsor of the bill. Mhm.
And this is, I like your amendment. I think these are good amendments. Montgomery County, the senator from Montgomery County brought me, there were some amendments apparently they requested. They didn't bring them to me as the sponsor of the bill. They brought them to Senator Kramer. But they also brought them to Bonnie Cullison over in the House, and she's putting those amendments on. So I'd like to pass this bill and then we'll maybe coordinate it with whatever the House does. Can we do that? Thank you.
Yes, we can. We're the Senate Finance Committee. No. Okay, let me just say, I want to thank the sponsor for this bill. I think that one of the things that I don't even want to get all sad, but as you all know, it's very tough when you have family members that need care. And in every jurisdiction in the state, there are people that are struggling. And so I really appreciate the bill because I think people need the assistance of somebody who can help them navigate. So thank you.
It's really difficult for people. So thank you, Madam Chair.
Yes, I would like to be a co-sponsor on this bill. Anyone want to be a co-sponsor? To get ready for the silver tsunami. That's everybody.
Everybody? Okay.
Okay, so we have a Finance Committee sponsor amendment joining the bill. And so I'll entertain a motion. Have a motion and a second for a favorable with amendments on Senate Bill 228. Seeing no discussion, all those in favor, raise your hand. That bill receives a unanimous favorable report. Next bill.
Okay. The next bill is Senate Bill 431. It says Washington County Senators is a sponsor, but is actually a statewide alcohol bill. You have a reprint in front of you. And I'll describe the bill and what the amendments do in one paragraph. Senate Bill 431 as amended authorizes a holder of a Class 9 limited distillery license to acquire a Class 8 liquor wholesaler's license similar to Class 1 distiller license holders. The amendments essentially allow a Class 9 limited distillery licensee to sell and deliver alcoholic beverages manufactured under the license in bulk to a person in the state and that is authorized to acquire them, and to a person outside the state who is also authorized to do that. And what these amendments do is it makes this approach consistent with the three-tiered system in Maryland regarding the manufacture, distribution, and sale of alcohol. As introduced, the bill would have just allowed these distillers to transfer their product directly, irregardless of the wholesaler step in the process, to retailers. This adds them to a category of license for wholesalers to allow this distribution, and then the three-tier system is maintained.
Senator Kramer.
Okay. How does this become a statewide bill? And as it sounds like in summary, you went from they can distribute directly to the retailer to now they're going to be, I guess they'll have two licenses, and that's why there'll be a wholesaler, a distributor, and then be able to get to the retailer.
Yeah, if you can see on the last page of the reprint, there is already an established Class 8 liquor wholesaler's license that's only for Class 1 distillers. It would add these Class
Right.
9 distillers to that license, so they would have to get another license to be a wholesaler to distribute their product to retailers. So right now, and it's statewide because there's at least 7 of these folks throughout the state. I guess there's one in Washington County that wanted this ability, but it's actually a statewide bill. It's not a local bill, so you don't have to have the vote of the Washington County Senators on this. Economic Matters Subcommittee on Alcohol has passed this bill as amended too. So it'll be coming to the floor over in the House, just like this.
Really?
Mhm. So I guess what you're doing is you're giving these class 9 limited distillery licenses the same ability as class 1 distillery licenses. licensees.
I know there's a bazillion different classes. Would you, if you recall, can you refresh my memory as to what these two different classes of distilleries can do? I'm assuming it relates to the volume that they can
I looked up,
produce.
I looked up what a class 1 was, and I think it's a volume matter, and they
Yeah.
these folks, if I read the law correctly, which again, we just got these issues this year. These are folks who also produce beer, and it's a limited license, and they can produce other alcoholic beverages, where a class 1, I believe, is just that, a major distiller.
So this could be not just liquor,
No,
or is it
it's
even
related-
liquor? Is it all beer?
It's only for liquor. They can
Okay.
they can only become a wholesaler for liquor.
Please.
Senator Hershey.
I was just gonna ask this maintains a 3-tiered system, but it expands opportunities for some of these small businesses.
That's a way to look at it. The testimony, if you recall, is they're located, I guess, this particular one was located in Washington County, and there's retailers just down the street that like their product, and they would have to go through a wholesaler to get the product to these folks, says they're just driving it down the street. But if you make them a wholesaler, they're still part of the 3-tier system as it is, and they can ship their product directly to that retailer down the street who wants to sell their product.
So did we hear from
There is no
wholesalers?
opposition. There is no opposition.
there
to
was
the
no,
bill.
well, I mean, I just want to make sure there's no opposition, maybe because it was perceived as a local bill,
Yeah.
right?
No, I think they knew it was not a local bill, and there was no opposition to the bill as introduced.
Okay, yeah.
Hey, what's your pleasure? I'll entertain a motion.
Move favorable.
Have a motion and a second for a favorable on Senate Bill 431 with the amendments on the reprint. Are there any questions? All those in favor of the motion, raise your hands, please. That bill receives a unanimous favorable with amendments. Next bill.
Okay, next bill is Senate Bill 542. And you have a reprint in front of you with amendments from the chair. So I will describe the bill. As introduced, it generally prohibits a person from selling an essential good or service, including a repair or reconstruction service, for a price that exceeds a 10% threshold during and in some circumstances after a state of emergency. The Secretary of State must establish a system by which a person may register to receive electronic notifications about the emergency. A violation of the bill is an unfair and abusive or deceptive trade practice under Maryland Consumer Protection Act, subject to civil penalty provisions that already exist. You have a reprint in front of you. And these are amendments again offered by the chair. And you'll see that the definition of essential goods and services is struck completely. So you're left with definitions of price, replacement costs. And if you go to page 3 of the reprint, there's a little mistake on the top here. E is going to have to change. I forgot to make that change in it, but that would be technical. In the middle of the page, you'll see that instead of the definition, a person may not sell or offer to sell essential goods or services designated as essential by the governor for a price of 15% or more above the highest price. So instead of 10%, the threshold moves up to 15%. in all instances in the bill. The middle part of this language here offers how long the state of emergency must last for this price gouging law to be in effect. And then at the bottom of the page, there was language that was offered actually by the Attorney General's office, but the chair included that as an additional instance when price gouging may not be determined to be the case, and that involves seasonal price changes charged by a person. At the bottom is a process for appeals, and if you go to the last page of the reprint, there was language altering the notification or the information that the Secretary of State shall establish, since there is no definition of goods or services anymore under the price gouging law.
Okay, Senator Hershey.
Thank you. So, and on the second page where everything now is deleted. But yet the cost increase is raised to 15%. Does that now apply to everything since we've deleted the
It
specified?
applies to whatever the governor determines to be an essential good or service in his executive order.
So
It's his emergency declaration, I'm sorry.
the governor is going to have to list a number of things.
Whatever is appropriate regarding the state of the emergency and the part of the state that the emergency is declared.
Okay, and then what's this seasonal,
There was some testimony during the bill hearing that some of these price increases could be seasonally related and have nothing to do with price gouging.
mhm.
So again, if, and this is all complaint driven, if somebody makes a complaint and the Attorney General investigates, then it adds that the person who would be approached by the Attorney General could say that my prices increased by more than 15% because of seasonal variations in my costs.
Okay, that makes sense. All right, thank you.
Vice Chair?
Is there anything in there, like, for instance, the eggs, how that went up because of that avian flu? Do we have any?
Well, there are things in the bills introduced. If somebody complains to the Attorney General, or enough people do, and they investigate and they find that the prices did increase beyond 15%, then the person, if you look at 1 or 2, the price increases directly attributable to additional costs imposed on the person. So it takes you up the supply chain. So if they can prove that their costs went up because somebody else's costs, they had to pay more for the product, then price gouging wouldn't be.
Thank you. And just a quick question, and then we'll go to Senator Reedy and then Mounts. This is indeed only if there is a declared state of emergency.
By the
So,
governor, yes.
By the governor. All right, Senator Reedy.
Yeah. I guess my question is, has this happened before? I mean, not has this happened before. I know we've had states of emergency. Has there been some demonstrated problem? I don't remember that from the hearing.
There were, I think they, in their testimony, Attorney General said they investigated 1,000 instances, 1,000 complaints of price gouging. I don't quite.
Complaints, yes.
Complaints. I don't recall quite the outcome of that. If you want, you could ask the folks from the Consumer Protection Division or here, Steve, but that's up to. But there were complaints of price gouging, and they investigated them under existing law and under the governor's executive order for emergency declaration.
Existing law they have, but this would make it just more clear in existing law what our powers are and put more of a percentage on it.
I don't quite recall what you put in last year's or in the bill that authorized the price gouging under the governor's executive order, but this would make it permanent in the law.
And lastly, can I circle back to the question about things designated as essential by the governor? Is like when the much sort of talked about and maligned in some corners decision to say essential businesses can stay open versus not when we had the pandemic, which I think was a lot of governors did that across the country. I think it might have been hindsight, been not the best choice. The hindsight's 2020. There was a predetermined federal list of essential businesses. probably in hindsight didn't make much sense, but at least there was a list. This is actually asking him to, so Governor Hogan or whoever didn't itemize the businesses that could stay open. They just,
This has nothing to do with whether a business can stay open.
I understand, but you're still, it's itemizing what services are essential.
What goods and services are, yeah, the governor, depending on the nature of the emergency, would have to determine what goods and services are essential. For the purposes of, price gouging for complaints about price gouging.
What if the governor is busy handling the emergency and they don't come up with a list? There is a list. Okay, all right.
Okay, I've got Mounts, then Hayes, then Vital.
On, on page 4, on line 5, it says, and this is the original text, a sale or offer for sale of essential goods and services in violation of this subtitle is number 1, unfair, abusive, deceptive trade practice. Number 2, it's a violation of Title 13 commercial law article. That's criminal. And then B, it says a person who suffers injury or loss as a result of a violation of this subtitle may bring an action under the commercial law article, regardless of whether the person is a consumer. So was this already actionable for anyone to bring a claim? And don't you have to have standing to bring a claim? Seems, I mean, that, so it says you don't have to be injured and you're still able to bring a claim. Am I missing something?
Well, without a specific law, I'm not sure anything would be actionable. You'd have to have something to be violated for it to be actionable. So now you have a law. So if this passes, you'll have a law. So yes, there could be, and you're authorizing an action.
Yeah, but wouldn't you have to be a consumer to be able to file a claim? It's like saying that, well, if somebody does something against somebody else, you're saying a third party has the right to bring it. That's what this is. Is that what this is saying?
No, this expands beyond a consumer, a person. Yes, that's a little more in the weeds than I'm used
Okay,
to.
thank you. Senator, that provision was because of this particular bill would apply not only to retailers, but people at the wholesale level if they're the ones that are causing the price gouging to occur. So this would allow, for example, a retailer to bring an action under Consumer Protection Act against the wholesaler that is, gouging the retailer. So that's what that provision is meant to address.
Would it make sense to say, use the words retailer and wholesaler? So, because the way I read it, I saw it as generally opening up an opportunity for anybody to bring a claim. It was just a point I wanted to raise and share with everybody.
I mean, you would still have to have suffered injury or loss as a result of the violation.
Okay.
So that would be it. If they haven't, they can't bring an action.
Thank you.
Thank you, Senator.
Questions? Senator Vital.
Thank you, Madam Chair. And since Mr. Sakamoto is at the table, I'm going to ask him. I seem to remember on the executive order from the governor, it did have a list of things that were considered to be looked at for price gouging. There was a list included. So this is just putting it into law, basically what the executive order did when COVID started, right?
Yeah, although this, the amendment that was offered by the chair would remove the list. We did, we had proposed, a definition of essential goods and services that was based on a law in effect in Florida that, had been acceptable to the opponents, but that was, but that's not what the amendment does.
So, and if I can just follow up, the reason for the sponsor amendment is much of the unfavorable testimony at the bill hearing and after was related to the specificity of the list and being concerned that it might overly, not necessarily be applied to a certain situation or emergency. A hurricane versus a pandemic might have a different list. And so the thinking was to do what was done, which is have the governor specify based on the state of emergency what the eligible items would be. Correct.
Thank you.
Correct. We're just not putting it in statute. Yes. Correct. Are there any other questions? What was the thinking on that language on the back page?
Well, if somebody wants to make a motion and striking person and be more specific.
Senator Mounts, did you want to work on that language on the back, that back page, or?
Goodness, a moment of truth. I was elected to do a job, Madam Secretary, or Chairman, and sure, I would like to. Absolutely. You want to do it right now, or can I have a little bit of time?
Nope, there are members of the committee that will want to see it in writing, right? Okay, so just want to, is this the last bill?
This is the last bill for today.
So
yes.
this is the last bill for today. What I'm going to suggest is you all stay close to your phones because we're going to be voting again, probably tomorrow. We have a couple of bills on hold that we're going to want to certainly get tightened up and get moving. We know most of them are already in motion on the other side, so we're in okay shape, but we want to get these done. So Senator, as quickly as you can get that recommendation to us, that would be great.
Thank you.
Okay. Okay. Any other questions, comments?